Hello, Dr. Huffman from Florida Injury Centers. Today is November 19th, 2024. Today is International Men's Day. I'd like to take this opportunity to talk to men about health issues, and in particular, the health of their back and spine. I'm an osteopathic physician. I've practiced medicine for 35 years, and I've spent most of that time in injury care or sports medicine, helping people recover from back injuries. So we're going to cover 7 points that might help you better understand the health of your spine and how to take care of your spine. So the first thing is to do proper lifting. Don't bend over and lift something. Squat at the knees, get the package close to you as possible, lift with your knees. Many of us are in a hurry. We don't take that advice. We got to run and grab it, and then all of a sudden, ooh, there's the pain. Once you get the back pain, you know it's going to be there for some time. So proper lifting may prevent that. Next, just general healthy lifestyle. No smoking, keep your weight down, proper hydration, nutrition, reducing stress. All of those things that we sort of preach in terms of general health is also important for good spinal health. Spinal health requires good vascular flow. Things that will decrease vascular flow are things like diabetes, smoking, inflammation. So just general healthy lifestyle will help you keep a healthy back. Good posture. I'm as much at fault here as anybody. I sit at a computer. I'm a telemedicine doctor. So I'm hunched over all day long looking at my computer talking to patients. You've got to get up, you've got to stretch, move your neck around, move your arms around, change and improve that posture. Sit up straight, even when you're standing. My wife's always reminding me when I'm standing around that I'm hunching over. Stand back up, put those shoulders back, just stretch a little bit. Posture is so important for the spinal system, and as you age and you get old like me, it starts catching up on you if you don't have good posture. Avoid repetitive heavy lifting. Now, many of you are in an occupation where you have to lift. I worked my way through college as a roofer. I was throwing these 60-pound bundles on my back all day long. Well, I could do that. I was a young man. I can't do that now. You have to be cognizant of the weight and the dimensions of the object. Call somebody to help you. If you have something that's a little bit heavy, don't go pick it up yourself. Get help. And if you have to do repetitive lifting or bending at your work, take frequent breaks. Lay on the ground, flat back, on your back, stretch. Make sure you take those breaks. Footwear is important. If you get poor footwear, it's going to translate into the legs all the way up through the spine. So wear something that's good padding. Another job I had in college was I worked in a factory. Worked building Ford Motors vehicles in Lorain, Ohio. And they had us on this concrete pad, and I would work there 12 hours. And again, I was a young man, but I'd still go home with pain in my knees and ankles. So if you're in a position in a factory or somewhere where you have to stand on concrete or steel, see if you can get some padding under there. Get good footwear, but see if you can get padding that you can stand on as well. Avoid prolonged sitting or standing. Another fault I have is I may sit for 4 or 5 hours before I get up. That's just terrible. As you sit or stand without movement, the disc between the vertebrae get compressed. And as they compress, it causes damage. So hydration is important to the disc, but stretching, getting up, moving around. If you're sitting at a desk and you can't get up, just twist around the desk. Move your arms. Jiggle your legs, move any way you can. If you're on a long flight, we know that we tell patients on long flights to get up frequently. Not only good for your spine, it prevents the risk of developing blood clots in your legs. So whether you're standing or sitting, do not stand or sit prolonged without some activities and changing in positions. Finally, if you've had back pain, see a physician. Don't ignore it. It may be something simple, and it may go away with time, but often I get patients that come to me who will tell me Well, I developed this pain 6 months ago, and it bothered me. Now it's shooting down my leg. Now I'm having weakness in my leg. It became more significant issue that could have been addressed early and treated early. So don't ignore neck or back pain. Don't try to work through it for certain. You're just going to make things worse. If you have neck or back pain, it's time to relax, stretch, yoga, water therapy, massage. Do not do repetitive injuries. We have problems with young men who will go to the gym and they'll hurt their back, but they want to push through it. So they push through it, and they may be out of work. They may be out of a workout period for months, if not permanently. So if you experience pain, listen to your body, take a rest, take an anti-inflammatory, aspirin, Advil, massage, stretch. That doesn't take care of it. Call a chiropractic physician, an osteopathic physician, or your primary care doc, and let them know, hey, I'm having some pain here. Should I be concerned? So I wish you all men, a good International Men's Day, and please take care of your spine. Thank you.